right? So if you look at an overhead squat, I need to have great mobility coming from my ankles, my knees, my hips, my thoracic spine, as well as my shoulder. And if I'm missing mobility at any area, I have to make up for it elsewhere. Okay. So the ankle is not only going to affect the joint immediately above it, it's going to affect several joints further up. Okay. And one of the big ones is going to be the lower back. So as I descend into a squat, I'm naturally going to get a little bit of lower back rounding or lumbar flexion, right? Some folks would call this butt wink. Butt wink is not inherently bad, right? But if you have an athlete in front of you that has flexion-based low back pain, their back hurts a lot when you round. If you can get more range of motion coming from the ankle, you may find they can squat more comfortably, right? So oftentimes in folks that have this chronic flexion-based low back pain, where every time they go back to squatting, they keep on hurting themselves over and over again, I'll see if we can get a little bit extra range of motion coming from the other joints, specifically coming from the ankle, right? Sometimes I'll add a heel lift or Olympic lifting shoe and see if we can get the depth we want without irritating the lower back, right? So the other way the ankle mobility is going to decrease stress on the lower back is going to be by changing the moment arm, right? And this is a physics equation. It's just like we talked about before. So in this graph, and I apologize if you're listening to this via podcast and it's confusing, go to YouTube and check it out because I have a nice graph that shows this all out, some nice images. So on the left is me doing a box squat. So when you do a box squat, there's very little ankle dorsiflexion range of motion, okay? And on the far right side, I'm doing a goblet squat with a heel lift, right? And with this goblet squat with the heel lift, I'm using all of my dorsiflexion range of motion, plus my heel is elevated, all right? And what happens in the far right situation, the goblet squat, my knee is so far forward, right, that I actually create a nice moment arm from my knee to my center of mass, right? And now the moment arm from my center of mass to my hips is very small. So when I do a heels elevated goblet squat and I really allow my knees to come forward, I end up allowing my knees and quads to produce a lot of force, and my hips and spine actually can't produce as much force, right? Now, if I compare that to the box squat on the far left, when I'm sitting back to the box, I have little to no moment arm for my knee to produce force. It's pretty much up to my hip and my spine to do almost all of the work, right? So if I have an individual that has a really stiff ankle, every time they try to squat, they're not going to be able to bring their knee forward to create a nice moment arm for the knee. They have to produce all that force from the hip and the spine, right? So what ends up happening is that if I have someone who has quite a bit of low back pain, they have zero ankle dorsiflexion range of motion, I might try to mobilize that ankle so I can get the knee to contribute a little bit more to producing force in the squat, right? So you can see how that'd be a nice strategy in folks that have this chronic low back pain with zero ankle dorsiflexion. We want to get them to be able to squat without as much pain, and movement at the ankle may help us with that.